and welcome to Vital Signs, a global look at health that knows no boundaries. I'm Dr. Sanjay Gupta. Since we're going to be covering so many miles together, I wanted to introduce myself. I'm CNN's chief medical correspondent, but I'm also a practicing neurosurgeon. I still perform operations once a week, and I still do make rounds. Just like the patients that I see one-on-one, you, the viewer, are an important partner in creating a healthier world. We begin with an ancient disease taking on a deadly new form. Tuberculosis is a disease of poverty sweeping across the developing world. But with the growth of international travel, TB anywhere can be TB everywhere. It's preventable, treatable, and curable. But inadequate care has resulted in a mutated drug-resistant strain for which there is no cure. I found one of the great and unlikely success stories in the fight against this strain in the mountains of Peru. It spreads like the common cold. Over 2 billion people are infected, but many of them don't know it until it's too late. The poorest are the most vulnerable. Meet 25-year-old Luis. He has a stronger, more potent, more resistant strain. That he is even here, alive, is remarkable. For him, tuberculosis began with shortness of breath, then coughing up of blood.
The entire left side of his lung is just whited out. The right side looks okay. How serious is this?
Posiblemente ese paciente hubiera fallecido.
His doctor tells me he could have died without the proper treatment. But Luis had no idea that where he lives would play a crucial role in his survival. We are in Lima, Peru, in one of the more mountainous regions just outside of Lima, and this is how a lot of people live. So it's no surprise when the person that lived in this particular home developed tuberculosis. The neighbor over there developed tuberculosis. The neighbors on either side developed tuberculosis as well. This is a contagious disease. It spreads, especially among the impoverished, especially among people who have very little ways of preventing it in the first place. Tuberculosis was once known as wasting disease or consumption because illness would consume or waste away the whole body. You see, TB bacteria lodges deep down in your lungs. It can shut down your immune cells, allowing bacteria to grow and multiply uncontrolled. When the bacteria die, they form a thick, cheese-like substance in your lungs that can harden, making it very difficult to breathe.
See the disease right here.
This is what a TB lung looks like. Big bumps where it should be smooth, and pockets of white. That's the TB infection.
Emergency situation.
In 1996, this Peruvian doctor started to notice something strange happening to his patients.
All these persons that you see with these pins, all of them were, labeled as people who will have a kind of death sentence.
They had no computers, no lab, no resources. So Dr. Jaime Bayona says they put together this rudimentary map to track the patients.
They were receiving the same treatment again and again and again, so they knew that they will not get cured at all.
It was a new kind of outbreak. Typically, TB treatment takes 6 months of 3 to 4 antibiotics. But when TB patients do not complete the full course of treatment, the strain can become even stronger, more resilient. It becomes resistant. Thus the name, multi-drug resistant tuberculosis, or MDR-TB. Even worse, extremely drug-resistant tuberculosis, or XDR-TB. Medications simply don't work as well, and patients died. But here's where the story takes a turn. You see, Dr. Bayona wasn't ready to accept defeat.
What made you believe that you could change that?
We got enough support in terms of provide to the patients the food they need, the proper housing, helping them with the transport to get the medicine on time. So we reduce the risk of abandoning the treatment.
True, MDR-TB treatment takes a long time, roughly 2 years. Most are taken orally, and at least one by injection. Some are painful, and all of them are toxic. Still, he and his partners had figured out how to save lives. It took more than just handing out drugs. Building ventilated homes, providing food, health worker home visits, transport to and from doctor's appointments, a comprehensive approach that worked, but all of it came at a high cost, about $20,000 per patient.
It was considered too costly, too expensive, and too complicated for poor countries, and patients should just be isolated and left to die on the side of the road. Sounds cruel, but that was essentially what the conventional wisdom was.
But Dr. Paul Farmer and Boston-based Partners in Health have never been ones to follow conventional wisdom. They already had proven programs in Haiti and inner-city Boston. Dr. Bayona sought their help.
Tuberculosis used to be just as stigmatized as HIV in many poor countries. Why? Because it was a death sentence. People got it and they could transmit it to other people. They could cough and transmit it.
A revolutionary collaboration kicked the TB program into high gear. Socios en Salud, Partners in Health, and the Peruvian Ministry of Health working together. Today, almost 2,000 patients with multi-drug resistant tuberculosis are tracked, and 3 out of 4 people with resistant TB are cured, a far cry from what was once considered a death sentence. And with more patients using the medications, the cost of treatment has gone down from $25,000 to just $3,000 or $5,000. As access to treatment goes up, stigma goes down. What you're looking at here is a tuberculosis ward outside a small town in Lima, Peru. What's so remarkable is that this place exists at all. To be able to treat tuberculosis in places like this that are so impoverished was thought to be impossible for so long. Tuberculosis is a severe infection, and these patients have multiple drug-resistant tuberculosis, one of the worst kinds, which is why I'm wearing a mask, and they're all wearing a mask as well. This is an x-ray, a chest x-ray of one of the patients. Take a look here. It is this area over here that is of so much concern. That represents the infection. That is exactly what doctors are trying to treat. Remember Luis? Take a look at what his life is like now. Well, we finally made our journey to Luis's home to get an idea of how he lives and how tuberculosis spreads. His home used to look something like this, and you can get a sense of just how close quarters they are to people around him, which is why it's no surprise that people around here, many of them do have tuberculosis. Take a look over here now. There's Luis, there's his wife, and there's her son, and most importantly, their new home. A little bit separated, better ventilation, key to try and prevent this disease from spreading. Besides the medications alone, it is that housing, it is that transportation, it is simply providing food that seems to make such a big difference. 6 days a week, Angela, a health promoter, comes to Luis's home. She makes sure he's taking his medications on time. They talk about his wife and young son and how he's feeling. Luis is a success story. His treatment ends this month. He says goodbye to Angela. But not every patient can be taken care of in the community. And for them, if they're lucky enough, they can find a place like this. Small little hospital nestled in the hills outside of Lima, Peru. They are often the poorest of the poor. They have no other resources. They have nowhere else to go. Also part of the program, sewing, gardening, researching on a computer, all geared toward preparing the patient for thriving in the outside world. Is it fair to say that this has become a model for the rest of the world?
Here in Peru, we were able to cure 60% of patients with extensively drug-resistant tuberculosis. Even in the U.S., cure rates are well under 50%. What they've demonstrated is that this can be done, and there's no reason that it shouldn't be pursued in every place this problem exists.
Success in Peru, but worldwide TB is spreading in ever more aggressive forms. 95% of all cases stretch across the developing world. The WHO names 22 countries highly burdened by TB. A look at those hotspots. China and the former Soviet republics have the highest rates of multiple drug-resistant tuberculosis. Russian prisons became a breeding ground for TB after the collapse of the Soviet health system in the 1990s. At one point, prisoners reportedly made up 25% of that country's new cases. Half of all new TB cases are concentrated in 6 Asian countries. In Africa, TB and HIV make a deadly combination. TB is a leading killer of people infected with HIV. Africa accounts for 85% of all the estimated HIV-positive TB cases in the world. Tuberculosis impacts every community. 1 out of every 3 people on Earth is infected with the bacteria that causes TB. Award-winning photojournalist James Knockway has been witness to the impact of TB around the world. Last year, Knockway received a grant of $100,000 and the opportunity to make a world-changing wish. His wish? To raise awareness of tuberculosis by photographing the human faces of suffering around the world.
My name is James Knockway. I'm a documentary photographer, and I primarily focused on wars and conflicts. In my work, I kept encountering TB. I realized that it was a huge global health issue. I saw people experiencing intense pain, their way of life broken, and my heart went out to them. This woman is co-infected with both AIDS and tuberculosis, which is a very common co-infection. She just grabbed hold of this doctor's arm as if she needed some kind of human compassion. I was also documenting the work of Father Michael Bassano, who spent 5 days a week changing diapers, bathing people, feeding them, talking to them. A lot of times patients are stigmatized, even by their own families. And I think Father Mike was so caring that he filled a gap in their sense of abandonment. And you can see in this picture this patient responding to him. I visited a TB ward in Cambodia. This is the poorest province in one of the poorest countries in the world. This boy had TB meningitis, which is kind of TB of the brain, among hardworking rice farmers who are anonymous in the outside world. I saw things of epic scale, epic suffering, and in this one small room, enough love to float an ocean liner. It's really a huge health problem in India, and that they go through a series of steps where they get x-rayed, and then these women are waiting with their x-rays to see a doctor for further consultation. The TB is preventable, it's treatable, and it's curable. The drugs are available, the means of diagnosis are available. What's needed most is organization and political will. If the pictures are difficult to look at sometimes, if they express pain and fear, well, that's the reality. And rather than making people turn away, it should make them feel compassion. And that's really my aim at the end of the day, that I feel that once a human bond is established, that action will be taken.
Aging smart. We head to Okinawa, where parents are outliving their children. We find out why.